This is a lateral view of the thigh. For orientation, we show the anterior superior iliac spine, and we follow the iliac crest posteriorly. We show the tensor fasciae lata muscle, which inserts on the iliotibial tract. The iliotibial tract inserts distally on the lateral tibial condyle. Posteriorly, we show the gluteus maximus muscle, which inserts along the posterior border of the iliotibial tract. We now divide the superior portion of the iliotibial band and their tensor fasciae lata from the iliac crest in order to reveal the gluteus medius and minimus muscles and the superior gluteal nerve. We have cut the tensor fasciae lata and a portion of the gluteus medius muscles free from the iliac crest and reflected them posteriorly. We show the tensor fasciae lata, the gluteus medius, and the gluteus minimus. We've placed a probe under the neurovascular bundle containing the superior gluteal vessels and nerves. We follow the superior gluteal nerve to the tensor fasciae lata. We prepare to expose the head, neck, and trochanters of the proximal femur. For orientation from medial to lateral, we show the adductor longus muscle, the femoral vein, the femoral artery, the femoral nerve, the psoas muscle, the sartorius, the gluteus medius, and the tensor fasciae lata. We reflect the sartorius muscle inferiorly, the rectus femoris, and the psoas muscle. We have removed the iliacus and psoas muscles to reveal the capsule of the hip joint. We now medially rotate the leg to show the position of the femoral head. We make a cruciate incision in the capsule in order to reveal the femoral head. With the capsule of the joint removed, we can see the glistening articular cartilage on the femoral head, and we see a portion of the acetabular labrum. The acetabular labrum is a rim of fibrocartilage which reinforces and deepens the acetabulum. We adduct and laterally rotate the hip in order to dislocate it from the acetabulum. We have a higher power view of the head of the femur. We show the ligament of the head of the femur are attaching to the fovea. This ligament may be an important source of blood supply to the femoral head. We see a region of arthritis where the cartilage has been worn away, and we see some small defects in the cartilage made during the course of our acetabular resection. We incise the capsule of the hip joint along the neck of the femur. We have removed the anterior portion of the capsule of the hip joint to reveal the proximal femur. We show the femoral head and the neck of the femur, the shaft of the femur, the lesser trochanter, and the greater trochanter. Attached to the lesser trochanter, we see the psoas and iliacus muscles. Attached to the anterior portion of the greater trochanter, we see the gluteus minimus muscle and the gluteus medius muscle. We've cut the attachments of the gluteus medius and gluteus minimus from the greater trochanter and have retracted them in order to show the anterior portion of the greater trochanter.